is your CT scan here. This is from the back, this is your spine, okay? You do have 12 sets of ribs. You actually have a pretty narrow rib cage already, but let's make it more narrow. So I'm gonna address rib number 12, 11, 10, and 9. So what's different about kind of what I do is I also address the front ribs. You know, I'm going for maximal waist reduction. So this lovely patient previously had a BBL in December 2024 with Lipo 360. She still has quite a bit of fat left. She went to a cosmetic surgeon for her last procedure. She had a fairly aggressive lipo, especially here along the flanks. You can see some of the discoloration, which is common with over-aggressive lateral lipo, but unfortunately she was also still left with quite a bit of fat, more than what we typically would leave with Lipo 400. So if you look here, you can see a lot of this discoloration, and that's just typically from over-aggressive lipo and quite a bit of scarring as well. So the goals today will be to do Lipo 400. So, you know, she still has a lot of leftover fat in her pubic area. And so I'm gonna address the pubic area, the lower abdomen, the upper abdomen, the brow rolls here on the side, the anterior axilla. And so that's the front part of Lipo 400, in addition to a lot of the fat that's here on the love handles and the waist. We're gonna do the entire back as well, and her arms. Did you have your arms done before?
Yes, I did.
I can't really tell, but there's a huge difference when I do my arms. Most people, when they get their arms done, they typically just get this part done, which is more of like the posterior arm. When I do my lipo of the arms, I do the medial, I do the posterior, I do the lateral, and I do the deltoid. So let's just see how much fat we get out. As far as the buttocks goes, we're going for obviously more of a disrespectful size and shape. So I'm gonna add fat kind of to this upper area where it's a little deficient, and add fat to the hips as well. This left hip is really deficient compared to the right. So we're really trying to bring more balance and symmetry. We did the oboli a few weeks ago, which really helped to smooth out some of these areas. And even when we put the fat in those areas where we did oboli, it should help to increase a lot of that projection. You know, based upon what I see and feel, it does look like a lot of the fat may have been previously injected into the muscle. We don't do that here. I don't inject the muscle just for safety reasons. We use the ultrasound, we put it above the muscle where we know it's safe. There's not a lot of large blood vessels there, so the risk of fat embolism is essentially zero. So with my rib remodeling or rib lux procedure, I'm going to address front ribs, typically ribs number 7, 8 in the front, sometimes number 9 if it's attached anteriorly through cartilage to the breastbone. And in the back, we're going to address ribs number 12, 11, 10, and 9. These are through super small, tiny incisions. I mean, literally like the size of a little dot. I go in with a tiny little needle. I'm able to address the ribs that way. No large scars. The whole goal is to narrow the waist as much as possible, but safely. So we always use it ultrasound to view the lungs, and we don't break the rib completely in half. We just do what's called a monocortical fracture, or just a one-sided rib fracture. So typically ribs number 7, 8, and 9 in the front, and in the back, typically we'll address ribs number 12, 11, 10, and 9. The goal is to convert any ribs that are considered false ribs or attached to the cartilage in the front into floating ribs, so they have no attachment, and that allows them to move in. Alrighty, so it's gonna be a crazy transformation. All right, stay tuned.
Let's go.
Let's do it.